So hi all, I am Dr. Arvind. I am presently working as senior resident in Department of Emergency Medicine in VMMC and Safdarjung Hospital, New Delhi. So today we will discuss about more of a career path. So the question we are going to discuss today is, should I take emergency medicine as a career option or not? These are my views as an emergency physician. This may be different for another person, or it can be the positives which I say as an emergency physician might be negative for another person, and the negatives which I come across might be positive for another person. So these are just my views as an emergency physician over the few years, like from 2019 until 2024. That is a long 6 year, almost 6 year journey. So first, what are the questions that will come in mind of every post MBBS student? The first thing is whether to take a PG or not. I think many of you would have this thought process would have come. This thought process would have come to your minds after your internship. Second question will be, which branch should I take? Some people will be like, everyone is preparing for post graduation, so I will also start preparing for post graduation. But then the question comes, which branch should I take? I think in my post internship days also, I was also a student like this. I was not aware of what should I take. So I think very few know what they want. See, for example, my friend, he was very clear that he will take only general medicine as a career option. But I think only few people have that clarity after completing their MBBS. So you can tell that this is the final lap which decides what you will practice, or what you will teach, or what sort of patients you will treat after this, or in your entire career, into your entire life. Because once you join the post graduation, or once you complete the post graduation, that is what you will be going to practice throughout your life, right? So that is what we are going to see. So what advice which I want to give to the pass out, those who have just passed out from the MBBS is, read a lot and about what is there outside. Learn from the experiences of people, and then decide on what you want. To discuss today is, first thing is, why did I take emergency medicine and how did it become my first choice? I will tell you a short story about what made me decide emergency medicine as my career. Second is, what are the pros and cons of being an emergency physician? Third is, finally, whether you should take an emergency medicine as a specialty or not. I think that by the end of the video, you might have a little idea whether you are suitable to be an emergency physician or not. So coming to the why I choose emergency medicine as a career option. So first thing is, during my internship, I didn't even open books, not even for once. It was filled with work, and the free time which I get, I used to sleep. Either I'll sleep or I used to hang around with my friends. To be frank, I don't regret in that decision because it was one of the most memorable times of my MBBS life. And I started my preparation after my internship got completed. So once the internship was done, I also joined the rat race for post graduation along with everyone else. But the thing was, I didn't have a clue about what I should take in my as a specialty. What I decided was, I joined this rat race and I decided to go with the flow, and I started my preparation of post graduation. So in the midway of my preparation, I had clarity about one thing, that is what not to take. So this is something which I will advise you people also. If you are not clear, if you are not sure, or if you are not clear about what you want to take as a career which will be continuing throughout your life, at least you should find out what things which you should not take, or what things you don't like. What are the post graduation, or what are the specialities which you feel that you will not have the skill or ability to become better. So what made me curious, or what interested me in emergency medicine was, these are the things. I'll get to see all sort of patients. I can see a patient coming with MI. I can see a patient coming with stroke, like that, all medical cases. I can see patients coming with like surgical cases, like for example a perforation case, a trauma case, polytrauma case. Sometimes the most confusing cases, which are the toxicological cases and what not. I'll be able to see all sort of cases. That is one thing which made me like curious or like interested in emergency medicine. I came to know that it's a well established branch in other countries. So had that feeling that it will be established in India too soon. That it is the branch which India needs the most because of this huge population, the number of polytrauma cases coming, the number of sick patients coming to the emergencies. So I feel that it is the need of the hour, and I still feel that India needs the emergency medicine department as a as a specialty. So initially I was interested in general medicine during my internship and post internship days, but what prevented or what inhibited or stopped me in taking general medicine was that I came to know that again I will go into that rat race of taking a super specialty. So I have told you before, right? Emergency medicine being broad, I get to see all sort of patients. But if I take general medicine, even for even for job opportunities, I'll be forced to take a super specialty because otherwise the job opportunities are very less. And I there is a chance that I will fall into the peer pressure. And apart from that, I might not be able to see this general the surgical cases and trauma cases, etc. So the last 3 months of my NEET PG preparation went only with one thought in mind. That was I will take only emergency medicine. So finally what happened? The results were out and I got a rank of 3000. But then I realized this is the most difficult part. That is because the rank 3000 was like on the verge. I might get general medicine. I can get a rank in DNB radiology at that time, 2019. So many of my seniors whom I spoke, they discouraged me, and even some of my close friends were not in favor of me taking this branch of emergency medicine. So some advised me to go to medicine and then do fellowship in emergency medicine, like that sort of thing. So I got very much confused then. But then I started researching more and more about emergency medicine, and I literally spoke to around 20 to 25 people who were in the field of emergency medicine at that time. So, which included my supportive and wonderful seniors. So, thus I entered the. So, after speaking to them, I was like, I got a clarity what is emergency medicine, what we are supposed to do in emergency medicine, etc. So thus I entered the world of emergency medicine. That too I was fortunate to study in one of the most reputed institutions in our country, that is the Nizam's Institute of Medical Sciences, Hyderabad. And I was also so lucky to be taught by a bunch of knowledgeable and supportive faculty and seniors who are still close to me. The pros and cons of being an emergency physician. So first are the pros. See, in the first slide itself, I have told you the positive of one person can be a negative of other person and vice versa. So the pros which I feel might be a negative or con for another person. So first about this. Personally, when we speak about the pros, when at work I have to be 100% involved in that, and when out of the work I can get involved 100%. I can give the 100% to my family, to my other hobbies or other things which I like to do. When it comes to opportunities, the opportunities are very good in emergency medicine, both in India and abroad also. So coming to the professional aspects of the positive aspects of emergency medicine, the one thing this I'll tell clearly, there is no typical day in emergency medicine. Every day one case will keep challenging you and keep you thinking, and makes an impact in the life of the patients also. So this challenge I found out very interesting while I was practicing emergency medicine in as a postgraduate. So this can be a negative for another person because some prefer to have a routine, typical sort of life, the typical seeing the same sort of patients, treating them, having a rapport with them, that sort of thing. But that will not happen in emergency medicine. Every day will be different. One case or the other will keep you thinking, will keep you confused. Some days we will be frustrated that we are not able to make a diagnosis for this particular patient. That can happen. But I feel that is a challenge for me, and I feel happy when I am able to find out the diagnosis and give the proper treatment. Secondly, it is a fast paced one. We have to be on toes. Sometimes you will get to see multiple patients coming together all at once to the red area. So you will have to think like which patient should I see first. So it will be always fast. When you are on the shift, I don't think we will get time to sit and relax for like 15-20 minutes and chit chat with everyone. Obviously, we find time in between the busy hours to get relaxed, to have a cup of tea and all, but still most of the times, unlike the other departments, we will always be on toes. We will get to see and treat patients as a whole. This I have observed. See, when a patient comes with a perforation with sepsis and the patient is getting a DK, so in this case, the management is a little confusing. The surgical management will be done by the surgery. The DK management will be different. So many of the, so many of these, in many of these situations, we will be able to manage the resuscitation part of the perforation. We will be able to manage the DK. We will those things we will get to see. Sometimes a patient comes to DK with myocardial infarction, DK with stroke, etc. So thinking process will always be wide. We will be able to think in all aspects. Second is the work hours. The work hours is flexible. So this again is a pro and a con. It can be a positive and a negative. So I'll be able to do many of my chorus which needs to be done during the day hours, because if I'm on a night shift, I have to go to do my some routine course like I have to go to a bank, or I have to go to visit my friend during the day hours. So in these conditions, it will give us a flexibility to go. If you are doing a 9 to 4 duty from Monday to Saturday, this will become a little difficult. In that way, I find it positive. Also, there will be sufficient gap between duties for you to relax. That is one. Because in my second year and third year and all, if I get an 8 to 2 shift, then I'll have a 2 to 8 shift. So it depends on place to place where you do your post graduation or where do you practice and all. But you will get a sufficient gap. If I'm doing a night duty, I'll get a post duty off so I can relax myself. Like that I can do. So that is one thing. Also, it will have a fixed working hours, especially during residency. I've seen it like if you have a duty, we will start from 8 o'clock. It will last till next day morning for other specialties especially. So but whatever when it comes to emergency, it is almost like fixed hours. From 8 to 2 means after giving over handover and all, we can leave by around maybe 8 to 2 duty. We can it might extend to 1.5 hours. It depends on the patient load and all, and we can leave in that fixed hours. There is no need for us to stay till the next evening like that. So that is one advantage which I feel. Coming to the negative parts, the always we have to work under pressure. the we have to deal with the treatment of the patients. Also, we have to speak to the bystanders and the attendants also. We have to explain to them what happened to the patient. If the patient is sick, we have to explain what are all the details. Secondly, the initial salaries, when it comes to the financial aspect, the salaries are good. As a immediately post broad specialty branch, the salaries are kind of good for emergency medicine. That is in one way because of the number of people are less. The usual demand supply mismatch is there. Demand is more, the supply is less. That's why the salaries are good. But it can remain stagnant for long, because I don't feel, unlike other specialties, like for being a surgeon, a neurosurgeon, a urologist, or a neurologist. So these super specialty branches, I feel that their salary might increase with time. There will be a stepwise increase in their salaries, but I don't think that will be the case with emergency medicine. The salaries, there won't be an exponential increase, a rise in the salaries in the coming years. That is one negative which I feel. Another negative which I came across after I started working in other hospitals also, one was the lack of awareness of the benefits of emergency medicine. This is emergency medicine specialty based care among other branches and also among healthcare policy and decision makers. Many people think that the old concept of casualty is good enough. There is a need of an emergency medicine specialty as a separate branch. I feel that many have that thought in their minds and views in their minds. So the problem is, whenever you are going to practice in a hospital surrounded by people who have these thoughts, it will become, we have to show them the difference which we make, to make them understand what is the importance of the specialty, or what we do in helping the patients, and also indirectly we help the other departments also. So we are forced to show them what we are doing. Second thing is the duty hours tend to be unsocial also at sometimes. Sometimes many of the times my friends have called me for a party at night, or sometimes they during the festival times and all, they will call to their homes and all, but I'll be in my shifts, so I'll not be able to go for that. So this is kind of a negative which I felt, because we'll be forced to work during many of the times when others are free and they'll be calling us. So it's like some unsocial hours we'll have to work. So working weekends and holidays, and also there won't be a regular sleep pattern we will get, because one day you'll have morning, then the evening shift you will have, then you will have a night duty. So you'll not get to sleep at the regular time intervals. It won't be like that. Coming to India, it's still a coming up branch. So if you're working at a place where the emergency medicine is at the initial stages, then what you have to do is you will be forced to push the same thing which I told you, push yourself to show others what you are supposed to do, or what you are doing, how it will be benefiting to others. So what everyone should understand is what we are doing is actually it will help in reducing the work pressure of other departments. See, coming a polytrauma patient is coming. So previously what you will do, someone will put an IV cannula, someone would start IV fluids, and then immediately they will call the surgeons or the orthopedicians. But now what we are doing is we will see the patient, we will follow the ATLS protocol, we will stabilize the patient, and then we will, if transfusion is needed, we will do a massive transfusion protocol, and after that we will inform the respective departments for the further management of the patient. So we are actually decreasing the work and the stress of other departments. I think slowly other departments will also come to know about the work of emergency medicine, because I have seen the same when I was doing my post graduation also. So again, few more negatives which I have felt is might have to deal with a lot of medico legal cases. It depends on where you work, who will be handling the medico legal cases. You should be trained to handle virtually any kind of emergency. See, for example, a pediatric child is coming to a cardiologist. See, for example, a medicine person, so he can tell that I am a medical physician, I'll not be able to manage this, you have to go to a pediatrician, like that. But when it comes to emergency medicine, whether it is pediatrics, whether it is a gynec patient, whether it is a patient coming with ectopic pregnancy, or a ruptured ectopic pregnancy, or a child in distress, so all cases you will have to see, virtually all cases. It can be a positive, I feel it, I take it like a positive actually, because it's like it's a challenge, we'll be able to see the patient. Another problem which I encounter almost, I have worked mostly in government setups, so is the crowd control. Sometimes majority of the time in your shifts will go in reassessment of the patient and retriaging the patient, and also the managing the patient rather than seeing new patients. Sometimes many patients will be coming, but we will not be able to see the patients in detail. We will not be able to see the new patients. When we go up the ladder, when we become a more senior faculty, what will happen is we will mostly involved in the shifting of the reassessing the patient, shifting that patient to ICU or to a ward, and so that the new patients can be taken in, so that juniors can see the new patients and all. So that crowd control aspect, we'll have to put efforts and time for that crowd control aspect, which I feel little like negative. When if you are more interested in the clinical part, it will become little hectic for you. And the lack of continuity in patient care, some take it as negative. The patient won't be remembering you, the patient won't be like, you have saved the patient but he'll not remember that. Even the attendants also, like even the bystanders also, what after some time what will happen is the patient will be shifted to a ward, he or she will be taken care of other department doctors for a long period of time, so they will remember them, so they'll be thankful to them, but you will not get that. Maybe they'll be have that feeling in their minds that this particular doctor might have intervened and saved my patient or saved me, but that you will not, the patient won't be coming back to you and saying that you helped me. Some instances will happen like that, but that's not very common compared to the other specialties. So you can take it as a negative or you can take it as a positive. It depends on person to person. So better to tell who will find it difficult to be an emergency physician. That is better than saying who should take emergency medicine. See, those who don't like to talk a lot to patients and the attendants, because you will be forced to explain everything, the problems in detail, and convince the patient, and in most cases the attendants, regarding the condition of the patient and help them make the decision. So this, if you are finding it difficult to deal with this, then it is a difficult scenario. You should have an emotional resilience. Sometimes the patient load will be more, have to work, talk, listen. Sometimes you will try hard to rescue or save a patient, but you will not be able to save the patient. So you should have an emotional resilience. So if you are a person who will be depressed when you are not able to save a patient, so then it will be a little challenging. You can't work alone, always need a team to have a patient saved. Always, it's always a teamwork. It's literally there is no existence alone, can say. So you have to keep hold of the on the team always. May have to do all types of work also. Sometimes you will, a patient is going, this airway is getting threatened, immediately you only have to take suction and give. A patient is coming with acute urinary retention, your junior doctors will be busy with some other work, so you will have to put a Foley's catheter. So literally every work you will have to do. and also need good cooperation with other specialties, because once you treat the patient, the second line of management should be done by the respective departments. So you should have a good rapport with the other departments also. And those who prefer to have a calm and peaceful environment, to be in a non-challenging situation, see the same sort of typical type of patients without any challenges, this is not a branch for you. You should, that is one negative which I feel. Negatively, those people should not take this branch. So, and if you are not a person who like to interact with multiple people, you like to establish your own like setup, in those conditions, in those situations, emergency medicine I feel is not a good option. So these are the things which I told, but there are some things which you will grasp during your residency or during your training period, which you feel that you don't have, but you will slowly grasp with time, which will help you improve yourself personally and also professionally. One thing is the communication skill. See, for example, I was not a person who I never thought that I will be able to speak to many people like this. I'll be able to speak to them and make them understand or not. But it will slowly, this communication skill will slowly improve with time if you put a little effort to it. Second thing is, if you consider each one in your team as integral for the working and set aside that ego or superior feeling, you will definitely build a good team. And this teamwork is the cornerstone of emergency medicine specialty. So though many will get frustrated and tired at sometimes, and we slowly realize that it is always a mix. We sometimes one day may be very good, we'll be very happy, and the other and will be exciting and will make, and some other day will be a bad day for you. You will get frustrated with the, maybe with the patient, or you will get disappointed and sad because you couldn't save the patient whom you thought that you could save. So it is like the part of the career. I think that is the same with almost all careers. The thing is, for emergency medicine, it is more, it will happen very suddenly, these things. And the fast decision making from limited information. So this is one thing. Patient coming with altered sensorium, you will start thinking about all the different scenarios of a patient coming with altered sensorium, so that we will only have a limited information because the patient is already altered. So this fast decision making skills from a limited information can also be arrived. Other than that, you might need more time and information. Other departments might need sometimes more time, more information, more investigations to make this particular diagnosis. But slowly with time, you will be able to diagnose this thing very easily. So these are the things which we will grasp slowly as you climb up your career. So finally, what I want to tell is, take emergency medicine. One, if you like to give your 100% during your work, and rest of the time do what you want to like, what you would like to do. If you like the fast-paced environment with lot of interaction with people, if you like to save the patient but don't want to follow up, or if you don't want to you will not get the credit of saving the patient. If you are okay with that, you can take emergency medicine. If you want to keep yourself challenged each day rather than to have a monotonous life, then emergency medicine is a good career option for you. If you are ready to be awake at night and to work during holidays, that is one negative. If you are ready for that, then emergency medicine is a good option for you. That's it for this. So I all the best for I expect that everyone, this video will be useful for you people to decide on whether you want a career on emergency medicine or not. That's it. Thank you.